there we go.
We're good.
I was looking at everyone's introductions in the chat, and I know some of you, but not all of you. So I love the fact that there's at least 2 anthropologists on the call. That's not a crowd I usually hang out with. So I think that's fantastic. Looking forward to learning from you and many researchers, clinicians, and policy and rehab, and not only from U of T, I see Niagara, family medicine, McMaster, I thought I saw up there. So great to see and meet many of you here today. So thank you.
Absolutely. So thank you so much again, everyone, for joining us. Catherine, I'm so excited to deep dive into today's discussion. This is a topic you and I have touched on many, many times in our meetings. It's actually one of the first kind of questions I'm about to pose to you. You actually posed to me on one of my first days here at the Leong Center, and clearly it hasn't left me. It's something that I'm constantly reflecting on, engaging in conversation with colleagues and community partners about. And I thought it was well suited for not only the first theme of the community engagement series, but this question is well suited to open up this session and our discussion at the engagement activity time point with those on this call. So my first question to you is, how do you define community and community engaged research?
Yeah, I guess I posed that question to you because I'm not sure I know the answer, but I think community means different things to different people, and it may depend on your personal experience or your field. I mean, I think of community in terms of membership, so a feeling of belonging or relatedness, that the values and views of the group has meaning to its individual members, but beyond the individuals. I see community as a group that tends to be integrated, that there's some sort of need fulfilled by being part of the group. And often community has a shared connectiveness by either values or emotions or philosophy, sometimes just by profession or a service that a group provides. Of course, by geographical location, certainly, but and in our ever virtual world, I think likely many of us think about community beyond a geographical location. And I guess when I think of community engaged research, I think of it as research that's centered in a particular community and that has meaning for a group beyond the individuals in that group, that may meet a certain broader set of needs or values of the group itself, and that has shared impact for the group. So those are some of the concepts I think about community, and I've had to think about this because I work in a quaternary care institution, but some of my interests are outside of the walls of the institution. So it sort of forces you to think about like who are members of the community within and outside where you work. So that's my working answer to your question. But I wondered over the last while if you have other ideas for how you think about community.
I do. It's funny you mentioned this. So just before the call started, we had touch points on this particular question. And I had mentioned that I've been grappling with it. I've gone back to mentors. I've gone back to community partners to engage in this discussion. And what I've come to learn as a social scientist and speaking with social scientist colleagues is that the term community seems to be really ambiguous, and that there really seems to be no apparent consensus amongst us as to what the definition of community is. And I'm glad that you brought up some of those key principles around, the sense of belonging, the sense of having shared value within the group, making sure that the engagement is not only meaningful, but there's a level of reciprocation that is involved in this partnership and collaboration that unfolds with community engagement. And that is mutually beneficial of a relationship. Often that can be lost. I sometimes worry, and you mentioned this, that when we think of community, we sometimes can be a bit simplistic in our thought process, that it's just geographically confined to a certain area, and we might be missing out, diversity within communities. And that's a bit of a concern to me that I grapple with, is that tendency to limit ourselves to geographically determined definitions. But, some of the ways in which myself and colleagues have thought about this to move forward, and I'm sure you're engaging in these types of conversations, and folks on this call are also doing this in their work, is, trying to understand the socio-political context of the communities in which you're working within, like determining what those inherent power dynamics are that exist at that local level and how they can be addressed within the important work that you're engaging in, and involving community partners at the onset. I know that you do that within TK, and we'll get to that point, but it's incredibly important that individuals, community be at the center of the development and ongoing implementation of projects, and that this really means that we need to encourage everyone in the community to participate, and having those bi-directional conversations as to what that looks like is incredibly important, and trying to foster that involvement in the project as much so as possible. Going back to this idea of placing individuals at the center of projects, fostering a level of meaningful involvement and collaboration with them, and providing support services in order to integrate and make more easily accessible the work in which you're doing. And that can be through arranging meetings. It can be through reports that are easily accessible and legible and at literacy levels that are appropriate to your community, so that they are equally engaged in its process and unfolding, and trying to think more innovatively and creatively of how we can do this through different representations, again, through consultation with community. But I'm constantly grappling with that question of what constitutes a community? Who's participating and who is not? And what does participation look like? And I think it's important that we continue this conversation with one another, continue to pose these questions, and collaboratively engage in these discussions so that we can have a better understanding of what exactly it is. That's my 2 cents. This kind of really segues well into another piece that we've been discussing within our community engaged projects and work together. And that's, how does community engaged research differ from patient-oriented or patient-engaged research? And I feel this is something that we're going to constantly come back to in this series and in our own conversations amongst one another. And I really want to elicit your thoughts on this.
Yeah. So I think this is a great question. I think there are a lot of similar values in thinking about patient-oriented. I call it parent or child engaged research, because not everybody is a patient. I guess everybody might be a patient, but I guess the sort of philosophy around that is, working from a place of centering the patient or the participant as really the focus, and likely the most important perspective in the research. And, as the priorities of the participant and the way the participant wants to participate, I think has to be at the forefront. It's amazing to me that we've just figured this out, but, that obviously is really, really fundamental in research in 2022. And I guess I think of, community engaged research has to be inclusive of the individual perspective, individual patient or participant, but also beyond that, in addition to the community, perhaps which they represent or for which they belong. And then I guess I start to think about, what is the community-based research sort of thinks around how could we forward or address a challenge on the community level? What does the community prioritize? How can the research have meaning or impact for the community in addition to the individual? But I do think some of the strategies, like, the values of respect and developing trust and avoiding tokenism and establishing roles and responsibility and accountabilities, I think we could borrow from the, patient-oriented lexicon, but I think we need to think about how to move beyond the individual when we think about engaging communities. Those are my thoughts on that.
I think that's great. And I love that you mentioned that there are kind of underpinning characteristics that are similarly shared between the two. And I often have to slow myself down when thinking about what exactly are those characteristics. But the shared characteristics are things we've already unpacked, not only in this call, but in our meetings together, like trust, for instance. There's a lexicon that's shared between the two. The way in which it unfolds may be a little bit different, but at the core of the project, it's bound to the same types of fundamentals, and often built, with the intent of mutual respect and mutual beneficiality to both parties. But can be complicated in and of itself, as we know. But you're right, it's taking the priorities of either the individual or the community and really centering that in the project and having that guide you in its determination as to where the impact will be. It's true. It's a question that constantly comes up. It's one that I certainly grapple with. But I always draw back to those characteristics in order to differentiate elements of how it would play out in patient engagement versus community engagement. And this is something that we will revisit actually in our upcoming session on October 20th to further unpack the complexities. But I'm glad that you started us off, Catherine, with some meaningful words of what this actually looks like from your perspective as a researcher, and coming from a great study like Target Kids. And I'm glad that you kind of set the tone for that. That actually leads me to the next question. So I keep mentioning Target Kids within this, so it's important for those on the call to have a little bit of perspective on what exactly that is. Can you describe how you've integrated community engagement into Target Kids for us?
Yeah, so Target Kids is essentially like a practice-based research network. We have anywhere between 14 and 16 practices really across the Greater Toronto area and in Kingston and Montreal. And we work collaboratively with these practices where we invite parents with young children to participate in, longitudinal data collection. And also they're invited to participate in a variety of randomized controlled trials. And I think sort of the secret sauce of Target Kids was likely when we thought it would be a good idea to have the research team members sort of integrated within the practice. So the research assistants basically become part of the fabric of the practice. So they integrate with the way that particular practice functions with the physicians, nurses, healthcare providers, administrative team members, parents, custodians, like of the actual practice. And then they really get to understand the values and the processes and the practices of that practice itself to enable them to do their work effectively and develop relationships. So in addition to the research team members, so of course our community is really the practices and also the research team members. And then of course, all the students and trainees that are part of like the family, I guess, or the community. And then within each of these practices, there are different universities, different researchers from different universities, really with the center being the parents and the children. So, really each practice is its own sort of unique medical home within its each unique community. They have their own policies and procedures, and they're situated in neighborhoods. So collectively, we're sort of a community of healthcare practitioners and parents and children and researchers and students and managers that try to come together around a common goal, which is to, improve health of children and families. So I think it's complicated because it's really at multiple levels, and it's trying to understand the unique practices and neighborhoods and populations and how it all fits together with a sort of a common goal. So I don't know if I described it well, but that's in essence Target Kids.
I think it's great. Like Target Kids does so much different type of work within that kind of umbrella term of Target Kids. You integrate community engagement well. Do you want to describe a little bit about the role in which you're a parent and advisory group play within that umbrella of Target Kids?
Well, we have a clinician and a parent advisory group. So those are, clinicians within the practices and parents of young children and children in those practices. And we come together, frequently to sort of, all the way from priority setting to reviewing tools, to making recommendations, to writing grants together, to publishing papers, to giving talks. So this did not happen overnight. This has been a very long process. And you can see and measure sort of palpable benefits to that. People become more engaged and passionate about the topics, and the work is better because of it. So that's been a really exciting process to be part of, sort of developing that community within the community. And some of the parent advisors are not actually participants. So people have sort of wanted to participate, even if their own primary care practice is not part of Target Kids, which has been an interesting development. So it's been very, we've learned a lot of things to do well and things that we could be doing better. So it's been really quite helpful. And we've also learned about how to develop sort of roles and responsibilities, how to pay people for their time, how to try to avoid being tokenistic. So it's been a great learning experience. Yeah.
Now, along your journey in community engagement with Target Kids and even outside of Target Kids, what has surprised you most in your journey of engaging with community?
Well, I think, I guess I can speak specifically about Target Kids. I think it surprised me at the beginning that how readily the practices were willing to sort of go on this journey with us. Even though it felt at the time they didn't really get much out of it in terms of, we took over some space and we probably slowed them down. And so that was surprising to me. I guess on the other hand, sort of the importance of building trust and relationships in really supporting the research is really, really key. And, when there are not constant intentional ways to nurture those relationships, that can be a problem. So, I think that those have been sort of, I guess they shouldn't have been surprising, but some of the surprising things along the way.
That's fantastic. And I guess the surprise also comes through this journey of integrating and engaging with community, some challenges. So I was hoping you could speak to sort of the challenges you've encountered in your work and how you've overcome them within Target Kids. I think it's great lessons learned to be shared.
Yeah, I think we always learn the most about when things haven't gone well. I learned the most when things haven't gone well. So, I think sort of sustaining the ongoing relationship, sustaining the funding for the practices is always a challenge. And, we always intended to include as many different practice types and many different geographical locations and make sure we had really good representation. But sometimes the trade-offs were a challenge because we have to have enough business, enough volume of young families to be seen in a practice to make it sustainable. Whereas, often for really good participation, you need to spend time and energy and sensitivity in recruitment and enrollment and supporting families to participate. And then, not all team members had good fit with the practices. And so strategies we've now used are, identifying research team members, hiring with the practices themselves. Those are some of the strategies we've used to try to make sure the fit's really good. And then having open sharing opportunities for the research team members to get together to say, in my environment, this is what works. And just really sharing, developing really a community within the team of ways to sort of support each other. And I think, I think supporting each other sort of in the role and also in life, and really supporting people, I think really goes a long way, because then people enjoy what they do and, get a lot of enjoyment and fulfillment about their work. So I think that's really, really important. I guess the other challenge is sometimes that researchers, metrics and processes for researchers are not at all similar to metrics or values sometimes of participants or of practices. So really keeping in mind, what is of value, and re-asking people what is of value to them, because sometimes values change, is really, really important. And sometimes we would lose track of that, right? We thought we were rowing at the same direction, but we may not have always been rowing in the same direction. So I think having intentional ways to check in with the community, whatever that community is really, really has been really important. It's been a challenge for us, and something we're always working to improve.
You've actually touched on 2 points that segue really nicely into our last question together in our conversation around communication, for instance, and its importance in the interaction in which we're having with community partners. And that community engagement is an ongoing and iterative process. Like, it's something that we constantly have to be reflexive on, revisit, and have these dialogues and conversations to ensure that the priorities remain in line. Because you're right, priorities do change, needs do change. It's important that we keep in tune with those within the communities that we're working closely with. And the question being, to jump board off of that, is, what advice do you have for clinicians and researchers who want to do more to engage community in their work?
Yeah, well, that's why I'm here, because I don't have all the answers. And I think there's many people here that may have really useful answers to that question. I mean, from my perspective, it's really important to get off on the right foot and set the tone. And I think to really remember what the motivation and rewards are for each participant. So that's the individual participant, but also whatever your community is, and just remembering that it's not always the same. And to really develop a plan with the community who have really good listening, even if it doesn't align with your vision. The times that I have not listened very well have not been particularly successful. So, you have to be flexible, I think, and really, as you said, have a good understanding about what motivates your particular community of interest, what their priorities are, even if they're not actually totally aligned. And then it really is about being organized, like outlining a set of roles and responsibilities, revisiting this in a planned and intentional way. I think sustaining these things through ongoing conversations, and, establishing trust, and then really being upfront, like, what are the timelines? What are the things you need to achieve? So everyone's really, as clear as possible from the beginning. And then finally, I would say just really working to ensure that whatever the community is, that they're experiencing benefit from their perspective from participation, and really trying to, share the findings in a meaningful way to the community, I think is really, really key. And sometimes it's left out of I've left it out, right? So I think that those are some of the advice I would have, but I'm looking forward to what you have to say and what other experiences, other people on the call's experiences have been.
Absolutely. I think what I'll do is stop the recording at this point.